Wow, AJ really explained the immune system in such a way that even a child can understand it. But he mentioned the fact that most of the immune system, the majority of the immune system, I think he said, cannot even see cancer cells. What did he mean by that? I was in LA earlier this year speaking at the Cancer Control Society convention, and I sat down with Dr. Tony Jimenez, and he shed some light on this information.
As physicians and as practitioners or advisors or counselors, we always tell patients and people in general, let's enhance your immune system if you have cancer. Because we know that the immune system takes care of a cold to cancer and everything in between. So that's the thought. Let's optimize the immune system, and we've gone a long way in addressing a cancer situation. But let's think about it this way. We know that in 1 cubic centimeter of a tumor, there's approximately 1 billion cancer cells. And that's billion with a B.
Okay.
65% of those cells at any one time are dormant. 35% of those cells are active. So they're in the synthesis phase of the cell cycle, not in the resting phase, okay? Remember mitosis in 101 biology, right? This is what we're talking about. So of all those cells, 99% of the cells are what's called non-cancer stem cells.
Okay.
1% about are cancer stem cells. So when someone has chemo radiation, they are not only suppressing the immune system, but they're making the cancer stem cells more active and more aggressive.
And that's the boogers you got to worry about.
Those are the boogers you have to worry about. Why? Because they survive in the bloodstream. They're immortal if you don't do something about them.
Right.
Not like the non-cancer stem cells that the chemo is affecting. So wow, someone has 80% reduction in tumor, or now you're in remission, and that's
you got rid of the good cells, and the bad cells you just strengthened.
right. And the non-cancer stem cells are not necessarily good cells, Ty, but they're cells that have a finite lifespan, and they make the bulk of the tumor.
Okay.
You see, so then the tumor decreases because the chemo and radiation can affect the non-cancer stem cell. So the patient has a PET scan, MRI, CAT scan, bone scan, whatever it is, and they have a false impression by their physician that now they can't see the tumor.